Hello and welcome to the demo of MedVisor. As you can see here, we have a very sleek, very minimalist UI. So this first link here is where a doctor would add data about their patient. So first we're going to need the patient's SSN, we're going to need their name, that's myself, their age, their gender, height in inches, their weight. The doctor's SSN is necessary because of how it maps the patient to the doctor in our database. And the disease name, let's say this patient has ALS, or I have ALS rather. Okay, now we can check if the patient's data has been added by querying that SSN of the patient. Let's find out, and there, everything I added is there. Now let's say that this disease isn't actually what I had, I actually have diarrhea. We can edit that. Let's say diarrhea. Submit. Now let's check if my disease got updated. Yep, as you can see here, I now suffer from diarrhea. So now let's go back to the main page. So now let's go to the doctor login. This is a doctor login. It's a very useful portal for a doctor. Say a doctor named Lori Cross wants to check some information about medications she's prescribed. Let's say it's these 5 medications. And she can see that this percentage of her patients are taking this medication, this percentage of her patients are taking this medication, this percentage of medications are used in all diseases across, this medication is used in, across all diseases, this medication is used in this percentage of all diseases, and they're also returned a list of their patients, and these are Lori Cross's patients, which it's always useful for a doctor to know the names of their patients, so they can also look up their patient and see relevant info about them. So let's look it up. So these are this patient's what meds they're currently taking and the symptoms they suffer from, and our portal, the doctor portal, also recommends other medications that could treat the symptom. Which might be useful to know in case, this medication, the medications this patient is currently taking is not useful for treating their symptoms, is not working, is not effective rather, and this, maybe they could give these a shot. Now let's go back to the doctor login. We like to keep our doctors in tip-top shape, so we also added a quiz to test their knowledge. Let's say I want to quiz myself on a disease. Let's quiz myself on AIDS. Okay, let me enter a medication I think is used to treat AIDS. Norvir. Oh, you got it right. Let me think of another one that's used to treat. Nope, that's not correct. So I have to go back to the beginning and I have to type in okay, from the beginning, just to, that's how we increase retention. Norvir. Now if I try to type Norvir again, because you've already entered this, so I gotta add something else. Let's see. I got these 2 so far. What's one more medication? Let's see. Yep, got all of them right. These are the 3 medications used to treat AIDS. And here's a recap, just to, make the doctor remember. We can be quizzed on another disease, or we could go to the doctor login, but I want to go back to the main page. So now we can go to the patient login. Say the patient isn't feeling so well, this portal, gives them a chance to figure out, what's happening to them. Say the patient's feeling a fever. Oh, these are all the diseases associated with fever. Okay, let's say the patient is also now feeling abdominal pain. Oh, okay, so these are the diseases that share both of these symptoms. That patient is also feeling some bloating. Oh, these 3 symptoms seem to map to this disease, and we found that these are the top 3 doctors treating this disease based on, these are the doctors treating the most patients with them. These are the medications for this disease which recommend it to Google. They recommend they check it out on Google. And that's it for MedVisor. It's a MedVisor as in med advice, medvisory, visor as in seeing things. Yep, thank you.